Hi again, Jason. Thanks for waiting while these results came back. Would you like a glass of water?
No, thanks.
Okay. Jason, the rapid HIV test that we just did was positive.
Wow. I don't believe it. I have HIV?
I can understand how this could be a bit of a shock to you.
No, I'm not totally shocked. I've always known it was possible, but I didn't really think. Oh man. I have HIV.
Now, Jason, remember that with this rapid test, a positive is considered a preliminary positive. A preliminary positive result on a rapid test means that it's possible that you have HIV, but we will need to do some confirmatory tests before we know for sure.
Does that mean the test is no good?
No, the test is good, but normally when we send blood to the lab for an HIV test, there are multiple tests that are done to confirm the result. Today, we have only one test, so we need to do another one to make sure that it's actually positive.
So, what you're saying is that it could be I have HIV, but it could also be that the test says I have HIV and it's really a false alarm?
Exactly. That's why we need to take some blood to confirm the test, which will take about a week to process. It's really important that you come back to get this result and that we know how to reach you in case anything gets in the way of you coming back in.
Okay.
Tell me what you're thinking right now.
I just have a lot of questions. My whole life is going to change now, isn't it? I'll never be healthy again. And how am I going to tell my family?
It sounds like you're feeling a lot of things. That's not uncommon when people first get a positive result. You don't have to decide everything right now. Take it one step at a time. Who do you feel you can confide in about this right away? Maybe not your family just yet, it sounds like.
No, not my family. I have some friends who are positive.
Is there one friend in particular who you feel you can tell about this?
My friend Tony, he tested positive last year.
Okay, I'm glad there's someone you can talk to. Someone who's been down at least some of this road before and knows how it feels. You probably know that HIV can be treated and that people can live a long time and be healthy with HIV. The treatments are better and easier than they used to be. Do you have a regular doctor?
Yeah, I go to her for thyroid problems, but I've always been really healthy.
Can you call to let her know about this and see if you can schedule an appointment?
I don't know. I think I want to wait for that second result.
That's understandable. Everyone is different, but if it was me, I think it would be hard to concentrate on much else until I got that result. For now, just take care of yourself. When we have more time, when this question is settled, we can talk in more detail, all right?
All right.
Do you feel like you can be totally safe in terms of any sexual contacts you have over the next few days?
Absolutely. Just with this looming over me, I won't really want to do anything now.
Would you like to call your friend now and ask him to meet you here?
Yeah, that's a good idea because I'm not going to know how I'm going to be feeling in an hour.
That makes sense. That way you don't have to leave the hospital by yourself. I know this was a surprise and you're feeling a lot of mixed emotions, but it sounds like you have some good support. When you come back for your confirmatory results, we can talk in more detail, and you can call us before then if you need to.
Okay, thanks. I really appreciate you talking to me.
No problem, Jason. You take care of yourself, okay?
In the emergency department, having to deliver a positive HIV test result is a real challenge. There's very little time for anything. Most providers are seeing multiple patients, and this can seem like a very onerous thing for a clinician to have to do. Despite that, in this situation, the provider did a great job of covering all of the necessary points and not pressuring the patient and not being rude. And I thought it was an excellent example of how much can be covered in a very short period of time.
A preliminary positive result on a rapid test means that it's possible that you have HIV, but we will need to do some confirmatory tests before we know for sure.
Does that mean the test is no good?
No, the test is good, but normally when we send blood to the lab for an HIV test, there are multiple tests that are done to confirm the result. Today, we have only one test, so we need to do another one to make sure that it's actually positive.
Preliminary positive test results require an explanation as to the two-stage HIV testing that is involved, and this can be time-consuming. This provider took the time to explain to the patient the nature of the test and the result, and the necessity of getting a confirmatory result.
The concept of a preliminary positive is a bit difficult and would be very difficult to take in upon just hearing that, in fact, your own test is positive. The clinician had explained the meaning of a preliminary positive before the test was taken and came back to it again.
The provider acknowledged that the patient was overwhelmed by this result, which is often the case, and that really normalized the patient's feelings.
It sounds like you're feeling a lot of things. That's not uncommon when people first get a positive result. You don't have to decide everything right now. Take it one step at a time.
Here, the clinician helps the patient not to feel overwhelmed by normalizing his feelings and clearly stating that they can talk about this piece by piece, taking it one step at a time. The clinician asks the patient who he can rely on for support. This is very important for patients who've just found out that they have a positive HIV test.
Who do you feel you can confide in about this right away? Maybe not your family just yet, it sounds like.
No, not my family. I have some friends who are positive.
Is there one friend in particular who you feel you can tell about this?
When the patient decides on a specific person they can talk to about the positive test result, this gives them a concrete step to take as they leave the clinic that day.
HIV testing in medical settings requires that we do linkage, that we link patients to care. That's even more critical in an emergency department. Ideally, emergency departments will have relationships with their HIV care clinics in the area, so that either a list of these clinics can be provided to a patient when they test HIV positive, or ideally, someone from the clinic can come meet the patient so that we can ensure that patients don't fall through the cracks. A dedicated emergency department physician can do a great job covering a lot with a client in a very short period of time. He doesn't have to do everything, but he hits the major points.
Throughout this interaction, the doctor is focused and efficient in delivering the content that he would like the patient to understand about the positive HIV test result without becoming insensitive to the patient's feelings or needs.